So, the treatment of acute dacryocystitis consists of before the abscess formation and localization of the inflammation, the hot compresses over the sac area, antibiotics and analgesics we can use. And when the inflammation has localized, then vertical incision to drain the pus with the removal of the sac when the inflammation is completely subsided and when lacrimal fistula is formed, there is a excision of fistula's passage and removal of sac or DCR can be done. So, for the chronic dacryocystitis, when there is a epiphora remains, a dacryocystohinostomy, that is DCR, it can be useful with no epiphora and no regurgitation. So, for the chronic dacryocystitis, we can use a dacryocystohinostomy, that is the DCR, and no epiphora with the no regurgitation is same. So the next topic is swelling of the lacrimal gland, that is dacryoadenitis. Dacryoadenitis may be acute or chronic. So this is a diseases of the lacrimal gland, that is acute dacryoadenitis. The etiology of it can see that it may develop as a primary inflammation of the gland or the secondary to some local or systemic inflammation. So when there is a primary inflammation of the gland or secondary to some local or systemic infection, it leads to the acute dacryoadenitis. Dacryoadenitis secondary to local infection occur in trauma with the erysipelas of the face, conjunctivitis, especially the gonococcal and staphylococcal and orbital cellulitis. Dacryoadenitis secondary to systemic infection is associated with mumps, influenza, and infectious mononucleosis and measles. So, dacryoadenitis it is secondary to local infection which is occurring in a trauma, erysipelas of the face, conjunctivitis that is especially gonococcal and staphylococcal and orbital cellulitis. And dacryoadenitis it is secondary to the infection to systemic infection is associated with the mumps, influenza, infectious mononucleosis and measles. When we can see a clinical picture of the acute dacryoadenitis, in that there is acute inflammation of the palpebral part is characterized by a painful swelling in the lateral part of the upper lip. So this is the acute inflammation of palpebral part and it is characterized by a painful swelling in the lateral part of the upper lid and the lid become red and swollen with a typical S-shaped curve of its margin. And acute orbital dacryoadenitis produces some painful proptosis in which the eyeball move down and in. So, in the lids are become red and swollen with a typical S-shaped curve of its margin and acute orbital dacryoadenitis produces some painful proptosis in which eyeball move down and in. A fistula in the upper and lateral quadrant of the upper lid may develop as a complication of suppurative dacryoadenitis. So, fistula in the upper and lateral quadrant of the upper lid may develop as a complication of suppurative adenitis. When there is a suppuration of suppurative dacryocystitis and its complications lead to the fistula in upper and lateral quadrant of the upper lid. So treatment it consists of course of appropriate systemic antibiotics, analgesic, anti-inflammatory drugs along with the hot fermentation. And when persists form, then the incision and drainage should be carried out. So, acute dacryocystitis, it commonly accompanies a systemic disease like mumps, influenza, or glandular fever, and it is characterized by acute local pain, swelling, tenderness, and drooping of the outer part of the upper lid with the characteristics S shape. And treatment, the infection is usually a self-limiting, and antibiotics with the local hot compress may be required in some cases. So acute dacryoadenitis is seen as a S shape of the upper lid. So, a patient with a bilateral dacryoadenitis note S-shaped curve of the upper lid. So, in that we can see that how the S-shaped curve of the upper eyelid with the bilateral dacryoadenitis. So, this is a very good diagrammatic presentation of bilateral dacryoadenitis in that A-shaped curve of the upper eye. Then next one is the chronic adenitis. So the chronic nephroadenitis is characterized by engorgement and simple hypertrophy of the gland. So when there is a chronic inflammation by the engorgement and the simple hypertrophy of the gland, it leads to the chronic adenitis. It is a proliferative inflammation of lacrimal gland and may occur as a part of generalized granulomatous disorders like syphilis, tuberculosis, or sarcoidosis, and it present as a painless, firm, mobile swelling of the lacrimal gland. So, the chronic dacryocystitis may occur due to the as a sequelae to acute inflammation. The second is in the association with the chronic inflammation of the conjunctiva. And third one is due to the systemic diseases such as tuberculosis, syphilis, and sarcoidosis. So, the clinical feature of acute dacryoadenitis shows that it includes a painless swelling in the upper and the outer part of the lid associated with the ptosis. And second is eyeball may be displaced down and in. And third one is diplopia may occur in up and out gaze. So, on the palpation, a firm lobulated mobile mass may be felt under the upper and the outer rim of the orbit. So, differential diagnosis shows that from the other causes of lacrimal gland, swelling is the best made after fine needle aspiration biopsy or incisional biopsy. And treatment that it consists of treating the cause is the main treatment of chronic adenitis. So when we can see a clinical feature, there is a painless swelling in upper and outer part of the lid, which is associated in the ptosis, and eyeball may be displaced down and in. With the diplopia may occur in up and out gaze, and on palpation there is a firm lobular mobile mass may be felt under upper and outer rim of the orbit. So this is all about the dacryoadenitis, and in that the differential diagnosis, that how we differentiate this from the other disease of the lacrimal apparatus, that from the other causes of lacrimal gland there is a swelling is the base which is made after a fine needle aspiration biopsy or incisional biopsy, and in the treatment that consists of treating the cause. So, the treatment of the cause, that is the removal of the cause, is the best treatment for the chronic dacryoadenitis, that is engorgement and simple hypertrophy of the gland. In that, there are some other syndrome like Dacryops. The Dacryops, it is a cystic swelling in the upper fornix due to the retention of secretion owing to the blockage of one of the lacrimal duct. So, Dacryops is a cystic swelling in the upper fornix, and due to the retention of secretion owing to when there is a retention of secretion, which lead to the blockage of one lacrimal duct, and there is a formation of cystic swelling, which is called as the dacryops. And the treatment that it is surgical excision of the marsupialization of the retention of the cyst via the conjunctival route. So there is a surgical excision is required for the these dacryops. So, this is all about the diseases of the lacrimal apparatus. In the next lecture, we will study the tumors of the lacrimal gland. Till that, we can stop here. So, in the next lecture, we will study about the tumor of the lacrimal gland. Till we can stop here. So, have a good day.